are eager to look at some of the larger detail involved. We're really mindful of how vulnerable the trans community is in this circumstance. And while the NHMRC is an excellent, place to kind of do a review of the standards of care, AusPath itself has been running and maintaining these standards of care for some time.
So that's just to be clear to our viewers, that's your organisation that's been running the standard of care. But as you know, your organisation's been criticised from some people who are worried about some of this. There are some health professionals who've come out and said that AusPath shouldn't be in charge of the guidelines. Is this the government trying to intervene so that you aren't the authors of the standards of care?
Look, the fact that there is going to be a new standard of care, as long as that standard of care is kept to the highest standard, which is what AusPath was doing, as long as we are going to avoid some of the pitfalls of the CAS review, which were things like there were no subject matter experts involved within the CAS review.
And that's just, again, for our viewers,
on record that
really important to explain to people who are coming in who don't know about this as much. The CAS review was the UK review into gender-affirming care for trans youth. It did lead to the pausing of puberty blockers. Right. Are you worried that that's where this is going to go as well, given the CAS review did lead to that happening in the United Kingdom?
So if the NHMRC does what has been put forward, which is to follow the best standards of care and put them together, then we shouldn't have anything to worry about. But again, I think it's really important that we keep reminding the NHMRC and the government that we do need to make sure that there is the voice of lived experience, and that there is also the subject matter experts who work in this space also must be included. The idea of perhaps if you were reviewing the clinical guidelines for cancer therapy and you decided that you were going to get together experts and none of them had clinical experience in treating cancer, you could then perhaps be forgiven in thinking that there might be a problem with that research.
How much consultation did you get with the government in relation to today's announcement?
So AusPath has been having a conversation with the government for a number of years, and we have been really pushing to improve, to update the standards of care. So the standards of care are an incredibly important aspect of delivering care. And in the last couple of years, there's been an explosion of new research. So at the clinical level, we really need to incorporate that research to update the standards of care. We've also seen that in Australia, which is quite different from other parts of the world, that the focus of clinical care in the tertiary environment, while very important, is just one aspect of delivering the best, gender-affirming care. So what we need to do with the standards of care is to update it so that there are other ways or ways outside of our really overstretched clinics to be able to provide gender-affirming care. I think it's really important to say that the great number of trans and gender-diverse people who are seeking gender-affirming care are incredibly capable of making those decisions themselves, including our children and young people, that perhaps the importance of something like the tertiary institutes and those clinics is for more complex cases.
So the Queensland government have their own review into this. They are also looking at it. They announced it, of course, before the federal government. Now Mark Butler wants them to drop their review. I haven't heard yet we have made a call to the Queensland government. I haven't yet heard if they're prepared to dump their review. They may not if they're not happy with the guidelines. Can you have two reviews running at the same time?
I don't think that you can. To be honest, we have 491 young people who woke up this week to discover that they were no longer on the wait list. And I can't tell you the anxiety and the upset that those young people would be experiencing, including their families and what their families are now having to do to make sure that their young people are safe. So with that in mind, and even if that was the only reason, we absolutely call for Queensland to lift that ban and to take the advice of the federal health minister.
Thank you so much for joining us.
Thank you for having me.